Rising colon cancer rates in young people. What we know and don't know. Colon cancer has historically been considered a disease of older adults, but recent research shows that rates are increasing among young people. While the reasons for this trend are not entirely clear, several risk factors have been associated with the disease. In this video, we will explore the potential causes of rising colon cancer rates in young people, including sedentary lifestyles, unhealthy diets, smoking, and environmental factors. Sedentary lifestyles and unhealthy diets. A sedentary lifestyle and an unhealthy diet are two of the most significant risk factors associated with colon cancer. Studies have shown that physical inactivity and a diet low in fiber and high in fat and processed meats are linked to an increased risk of colon cancer. A sedentary lifestyle and a diet high in processed foods can lead to obesity, which has also been identified as a risk factor for colon cancer. Physical activity helps to reduce the risk of colon cancer by promoting regular bowel movements and reducing the amount of time that carcinogens spend in the colon. On the other hand, a diet high in processed meats, which contain nitrates and other harmful compounds, can damage the colon lining and increase the risk of cancer. Smoking and heavy alcohol use. Smoking and heavy alcohol use are also associated with an increased risk of colon cancer. According to a study published in the Journal of the National Cancer Institute, smokers are more likely to develop colon cancer than non-smokers. Heavy alcohol use has also been linked to an increased risk of colon cancer. In both cases, the chemicals in tobacco and alcohol can damage the cells in the colon lining and increase the risk of cancer. Environmental factors. Environmental factors such as exposure to pollutants and chemicals are also thought to play a role in the rising rates of colon cancer in young people. Pesticide, for example, have been linked to an increased risk of colon cancer, particularly in farmers and others who work in agriculture. Exposure to other environmental toxins, such as heavy metals and industrial chemicals, may also increase the risk of colon cancer. Genetic predisposition. While lifestyle and environmental factors are thought to be the primary drivers of rising colon cancer rates in young people, genetic predisposition may also play a role. Certain genetic mutations, such as Lynch syndrome and familial adenomatous polyposis, are known to increase the risk of colon cancer. People with a family history of colon cancer are also at increased risk of developing the disease. Changes in screening practices. Finally, changes in screening practices may also be contributing to the rise in colon cancer rates among young people. In the past, colon cancer screening was recommended primarily for people over the age of 50. However, recent studies have shown that rates of colon cancer are increasing in younger people, leading some experts to recommend earlier screening. The American Cancer Society now recommends that people at average risk of colon cancer begin screening at age 45. Conclusion. The reasons for the rising rates of colon cancer in young people are not entirely clear, but several risk factors have been identified. Sedentary lifestyles, unhealthy diets, smoking, heavy alcohol use, environmental factors, genetic predisposition, and changes in screening practices are all thought to play a role. To reduce the risk of colon cancer, young people should focus on maintaining a healthy lifestyle, including regular physical activity, a diet rich in fiber and low in processed meats, and avoiding smoking and heavy alcohol use. It's also essential to be aware of family history and to discuss screening options with a healthcare provider. By taking these steps, we can work together to reduce the incidence of colon cancer and improve outcomes for all.